This week, a robust roundtable on transformation in the advertising industry as one small black-owned agency accuses the industry of change hypocrisy. And a leading soap brand embarks on a bold social experiment that explores how women view their own beauty. This is Mags on Media. A warm welcome. All of that is still to come, but we'll start this week with health journalism and this assertion as the fallout regarding misinformation about vaccines and antiretroviral shows words can kill. So, how do we right wrong health reporting and correct those dangerous misconceptions? To that end, the Bhekisisa Centre for Health Journalism has been launched. The director, Malan, is with us, along with Tanya, Pampalone, executive editor from the Malan Guardian. To both of you, a very warm welcome and thanks. Mia, let me start with you. This misinformation in medical reporting, is it due to ignorance or simply bad information that is being fed out?
I think it's a combination of various factors. I think the example that you mentioned, the vaccine example, for instance, in England about 10-12 years ago, people started to believe that the MMR vaccine causes autism, which was really based on a study that was not scientifically sound in many respects, and it was not the kind of study from which you could draw those kind of assertions. And I think the same happened in South Africa during the Mbeki era, with the HIV dissidence era. First of all, reporters in South Africa, when they report on health, need a sound science training. And I think especially, for instance, with HIV at the moment in our country, with the antiretrovirals that have become available, it really does require journalists to understand science and HIV science quite well. But I think on the other hand, it's also sound journalism. It doesn't help to have a good knowledge on science and not have the journalistic skills to simplify that for readers and for viewers to understand it properly.
Tanya, the problem, of course, is that those of us in the media often tend to oversimplify the issue, and inevitably we're looking for that snappy headline that's going to either sell newspapers or bring viewers or listeners in.
I suppose so, and I mean, and that's why we're so lucky to have someone like Mia heading up the centre and bringing. Actually, she brought this initiative to the Malan Guardian with the German government, and that's exactly the kind of thing that you won't see on Mia's pages.
Part of the problem here, of course, is the medical profession itself, is that often they are notorious for not being able to explain themselves. Surely there's a bit of work to be done in that respect.
Absolutely. I am a strong believer that the medical industry needs as much training in communicating their information as journalists need in communicating medical information. So I think with our centre, when we expand, one of the areas in which we would like to expand to is to provide that sort of communications training, and also to provide a sort of a training where you help medical professionals to write good op-eds. We get a lot of op-eds at the Malan Guardian, and they often have to be edited in a strong way, and I think it would be very useful to work with medical professionals in that regard.
Tanya, from a reader perspective, or perhaps from a viewer perspective, do you think there's a real appetite for good health journalism, or is it something that we tend to shunt to the margins?
Well, I think we have for years. I mean, I do think it's been kind of on the margin for years. I think it was one of the first things that, you know, as the budgets tightened up, we dropped. And so we have to find these different funding models, and I think this partnership is kind of like the future of those areas that we tend to neglect, that we can't get funding for, because we can't say, you know, here's our lifestyle supplement or whatever. And in this way, we're showing with this private public partnership arrangement that we can do good journalism, and that we can focus on health, and that we will. And that's what we'll have 4 dedicated pages in addition to the health coverage that Mia and her team will have in the main body of the supplement.
You're not going to do this all by yourself, of course. Yeah, part of the problem is those skills that you were referring to a little bit earlier.
Well, when we decided on who would we appoint, because we had funding for more than just me, we specifically made a very conscious decision to appoint 2 very young reporters, so that we can contribute to sort of creating the next generation of health reporters in South Africa. There's a lot of mentoring and editing that goes along with the process of reporting, and we also offer fellowships for journalists from other media houses, working journalists, to join us for 3 months at a time and receive mentoring, and then to go back to their media houses to apply their new skills.
It all sounds very good, but let's be honest. If you're setting out in a career in journalism these days, you know, you want to cover politics, you want to cover crime. How do you make health journalism a compelling beat to a young reporter?
I think health is a political issue in our country. I was a young health reporter at the time of the HIV dissidence debate, and I worked for television, and the story was almost the main story every single night. We are heading for the NHI, the National Health Insurance Scheme. That is extremely political, and it's a policy issue. It's going to influence every single aspect of your life, how much taxes you pay, how much of your salary you get out, and whether you're going to be able to afford a medical aid if they still continue to exist. So I think health in South Africa can absolutely be made a hardcore political issue. And of course, there are other health stories that you can humanize. The trick or the skill is to make people realize through your story that it affects every aspect of their lives.
As with all great journalism, the narrative is absolutely critical. To both of you, thank you very much indeed. Appreciate your time. Coming up on the program, 3 young advertising executives take on the industry, claiming that transformation is a misnomer.
We were the blue-eyed boys. The minute we walked out and started our own agencies, guess what?
News that moves. ENCA.com.